I'm Ryan Castle, and I just spoke at the Society of Cannabis Clinicians Conference. I am the president of the Whole Health Oncology Institute and the director of research at Eric Cancer Playbook. Honestly, this has been a fantastic experience at the crowd. The conference has been incredible. The speakers are truly and deeply engaged in not just the biochemistry and the clinical outcomes of medical cannabis, but also on the patient experience. And that's something that I really love to see, is how many times I've seen presenters talking about the fact that we can't reduce medical cannabis down to a single metric or a single marker that we're going to track, and that it constitutes the entirety of care. We need to look at what is the actual result for quality of life? What is the actual impact on people's lives? That's been lovely to see. Patient-reported outcomes are absolutely essential because we focus all the time on clinical trials, and that's evidence, but we also need experience to back that up. Patient-reported outcomes capture the lived experience of what cancer patients are going through, and that is just as valid as whatever biomolecular studies are showing. If we don't have the patient-reported outcomes, we only have half the picture. So cannabis in itself is extremely helpful for cancer patients. It is able to affect their quality of life, pain, nausea, all sorts of things. But when you have full extract cannabis oil, or FECO, you see a huge spike in the efficacy. And not only does it reduce a lot of the symptoms that cancer patients are suffering from, treating everything from the chemotherapy side effects to the direct symptoms of the cancer, but it's actually been associated with reductions in cancer itself. We've mapped it to reducing tumor sizes and improving outcomes for cancer patients. If somebody donates to Eric Cancer Playbook, we don't believe in asking for money that we can't report exactly what it's going to do. So every single dollar that is donated, we have mapped to exactly how many lives it's likely to impact. Not just whether or not it's going to impact somebody's life or not, but in fact, how many healthy life years it's likely to help give them. Because when you educate somebody and when you give them additional medicine, additional tools and resources, you change the course of their lives. And so you can see $100 can make a difference in impacting 30 lives, can save a total of over 100 disability-adjusted life years of giving people back years of healthy living that they wouldn't have had otherwise if they hadn't had the tools, the resources, and the medicine that Eric Cancer Playbook is able to give them.